signs and symptoms of autism. Knowing the symptoms of autism is very important for us, because it can help us in preventing the occurrence of autism in children, anticipate and do early treatment. The Inspector Autism is a group of closely related disorders that have similar symptoms. Autism spectrum disorders are characterized by disturbances in communication, social interaction and relating to others. In the past, autism disorders were often not diagnosed until a child was 3 or 4 years old. But as more is known about autism, children can be diagnosed at an earlier age, which means treatment can start earlier. People often ignore the warning signs of autism until the problem becomes severe. If your child has multiple signs and symptoms of autism, ask your doctor to check your child's health levels and get the best treatment for autism. Here are the early warning signs of autism in children. 1. Not smiling or showing other happy expressions. Did you ever smile at a baby and he gives you a great big toothless grin back? By a certain age, most babies respond to a facial expression or a smile, especially from a parent. Typically, babies start to laugh and squeal by around 6 months of age. But it is also important to understand, some babies are all smiles while others are a little more subdued. Variations in how much a baby smiles are also normal. In addition, babies start showing joyful expression at different ages. But if your baby is not smiling by about 6 months of age or laughing in response to your playfulness by a year, it can be an early sign of autism. 2. No eye contact. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. Early signs of autism in babies and toddlers often involve the absence of normal development, not the presence of abnormal behavior. For example, if your baby does not make eye contact when you are doing things, such as feeding or playing with her, it could be a sign of a problem. In general, babies are interested in faces and will meet a parent or caregiver's eyes at least some of the time. If your baby or toddler resists eye contact on a regular basis, it can be an early sign of an autism spectrum disorder. 3. Not babbling. Before babies say real words, they talk by cooing, babbling and making other sounds. Making various sounds is a precursor to talking and part of normal language development. Although babies don't all follow the same time frame when it comes to language development, most babies make some attempt to make sounds by about 6 to 9 months. For example, babies often start making vowel sounds, such as O or O at around 6 months. A few months later, babies often babble a bit more by making sounds, such as gaga. By around a year, babies often direct their babbling at another person. If your baby is not babbling by about 9 months, it does not mean there is definitely a problem. But it's best to talk to your pediatrician to determine if any testing is needed. 4. Displays unusual movements. Many babies and toddlers do silly things including odd movements or repetitive actions. The children who have an autism spectrum disorder may engage in repetitive movements and activities known as stimming frequently. Common repetitive movements in children with autism may include rocking back and forth, head banging and hand flipping. Additionally, not all stimming behaviors involve movement. Some may be visual, such as repetitive blinking or staring at lights. Stimming behaviors are done to stimulate a person's senses and are often a sign of autism spectrum disorders. 5. No words by 16 months. Developing language skills is a gradual process, and babies say their first word at different ages. Some babies can say several words by their first birthday while others may not be as verbal. There are many reasons why you may have a late talker, which have nothing to do with autism. But communication delays can also be an early sign of autism. If your baby does not say any words by about 16 months, you may want to consider having her evaluated. In addition to delayed communication, some children with autism are verbal, but they may not use their words to get what they want. For example, a toddler may know what a cup of milk is when shown a picture, but she may not be able to ask for milk when that's what she needs. 6. No attempt to compensate for speech delays. Speech delays are not always due to autism. There are several different conditions that can lead to delayed language development. But in many instances, toddlers will compensate for language delays by finding ways to communicate other than using words. For example, babies and toddlers who do not use any words will make gestures and point to objects. Babies will often lift their arms up to let you know they want to be picked up. This type of nonverbal communication is also part of language development, which children with autism may not display. 7. Does not want to be touched or cuddled. Babies thrive on affection. In fact, research shows babies who do not get cuddled or shown physical affection can have development delays. Although babies and young children do vary on how much snuggling and affection they enjoy, most babies and toddlers do enjoy hugs and affection from their parents. Babies who do not want to be touched may resist cuddles or squirm to get away from a hug. You may also notice your baby is excessively fussy with no known cause and is hard to comfort. This resistance to affection may be due to sensory disorders issues that can accompany autism. Please note, the content provided below and elsewhere on this video is not intended nor should it be construed as providing professional medical or nutritional advice. Do not rely on information provided on this video for your health problems. Instead, consult a qualified medical professional for advice. Ten habits that make you age faster and look older. With age, the skin becomes thinner and drier. This leads to fine lines and wrinkles, increased pigmentation, loss of elasticity and firmness, and dull skin. At times, body starts showing aging signs sooner than you might expect. Several environment, lifestyle and dietary factors can cause premature aging. This makes you look and feel older, faster. But by taking care of your skin and overall health, and avoiding certain day-to-day habits, you can prevent premature aging. Here are the top 10 habits that make your skin age faster. 1. Smoking. It is a known fact that smoking harms your health in many ways. But smoking can also accelerate the aging process of your skin. The harmful chemicals in cigarette smoke chronically deprive your skin cells of oxygen, which can lead to pale, uneven coloring. It even triggers the breakdown of collagen and can cause loose, saggy skin. In fact, the whole process of smoking can cause deep wrinkles around the mouth. A 2007 study published in the Journal of Dermatological Science reports that smoking tobacco leads to accelerated skin aging. So, those who are more concerned about their appearance should try to stop smoking. By quitting smoking and avoiding secondhand smoke, you can restore your skin's health. A 2010 study published in Skin Journal reports that quitting smoking improves skin conditions and, above all, skin aging effects. 2. Drinking in excess. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. Alcohol is a natural diuretic, so when you drink in excess it causes dehydration. Dehydration depletes the natural moisture from your skin, which automatically makes you look older than your age. Excess alcohol intake causes a depletion of healthy nutrients in your body, particularly vitamins A and C. These antioxidant vitamins are essential for maintaining vibrant and supple skin. Plus, excessive alcohol intake is one of the triggers for rosacea outbreaks. High alcohol intake is even associated with skin cancer. A 2014 study published in Cancer Causes and Control reports that higher current alcohol intake, higher lifetime alcohol intake and even a higher preference for white wine or liquor were associated with increased risk of melanoma and non-melanoma skin cancer. 3. Holding grudges. Forgiveness is something most of us believe in, but we don't always practice it. Holding grudges against any person or situation is not good for your health as well as appearance. If you are not able to forgive, you are adding more stress to your life, which boosts your level of the hormone cortisol. Cortisol leads to weight gain, high blood pressure and high blood sugar. Stress even leads to more frowning, one of the key causes of wrinkles on the forehead. A 2005 study published in the Journal of Behavioral Medicine highlighted the link between lack of forgiveness and reduction in stress. Stress is a common cause of many health problems and also contributes to aging. Do not allow an old grudge to sap your youthfulness. Practice forgiveness and experience better mental and physical well-being. 4. Sun exposure. No matter how amazing the sun feels on your body, regular and prolonged exposure to sun rays is one of the worst things you can do for your skin. Long-term exposure to harmful ultraviolet (UV) rays of the sun weakens your skin cells and blood vessels, which causes a tanned, leathery-looking skin. It even leads to pigmentation, reduced skin elasticity and a degradation of skin texture. Also, the risk of skin cancer is significantly higher due to sun exposure. A 2013 study published in Clinical, Cosmetic and Investigational Dermatology states that UV exposure seems to be responsible for 80% of visible facial aging signs. Freckles can turn into brown sunspots, the skin takes on a dry, leathery appearance, and wrinkles and sagging increase. Before going out in the sun, protect your skin by wearing a hat, covering up with clothing and using sunscreen that is broad spectrum, SPF 30, or higher. You should apply sunscreen throughout the year. If you like a tan look, apply self-tanner rather than soaking up the sun rays. If you are worried about sun-damaged skin, consult a doctor to reduce existing damage. 5. Too little sleep. Just one night of bad sleep can make you look and feel tired. It can even lead to dark circles and bags under your eyes. Now, imagine what lack of sleep for days can do to your skin appearance. Sleep deprivation can cause skin damage in several ways. First of all, it can increase your cortisol level, which in turn can worsen inflammatory conditions. Secondly, it can cause poor collagen formation, which leads to skin aging. In a 2013 study by the University Hospital's Case Medical Center, physician-scientists found that sleep quality impacts skin function and aging. According to the study, poor sleepers had increased signs of skin aging and slower recovery from several environmental stressors, such as disruption of the skin barrier or UV radiation. Staying up late can be fun, but burning the midnight oil can make you look older as you age. To enjoy beautiful and flawless skin, make sleep a priority and try to get between 7 and 9 hours of sleep per night. But avoid sleeping too long on one side of your face, as it can cause wrinkles and sleep lines. Also, use a satin pillowcase to avoid fine lines and wrinkles.